But now we have the guest, and we have Manuel from Barcelona. And he is heading the Behavior Design Lab at the Open University of Catalonia, right?
Yes.
Okay. And he's passionate about using behavioral science for health and well-being. So he has experience, expertise, and ideas and projects to share with you today. So pretty much it will be some components that we cover in the class that are related to the human change, human thinking, the behavioral stuff, and then specifically addressing some of the health issues. And of course, because health relates to humans and humans are we, that's why everything that Manuel will share will be one way or the other related to our personal lives. And then sometimes also our organizational lives and like a social well-being in general. So thank you for joining us. And now I will let you to introduce more yourself and give some more of your experiences. And students, I welcome to be ready with the questions. And also, I also invite Manuel to ask questions to the students and test some of his ideas of what's going to work also for your companies. Maybe something yes, maybe no. Okay, floor is yours.
Thank you so much for giving me the floor, and their friend, Agnis. Thank you so much to all the students. I am very grateful to be here today. For me, it's a wonderful opportunity to share a part of my time with you. You are a very lucky group of students because you have your professor is one of the most reputed behavior scientific designers around the world. Don't forget that. And in this sense, I think I feel myself like another student. Thank you so much, Agnis, for giving me this opportunity. Okay, I have a first question. What do you think that is health? Let me share my. What do you think that is health for you? Some answers. Health. The health definition.
I was also asking students questions about defining the terms that I use as a title of the course. And it was quite interesting discussion because intuitively it might be, okay, I know what design is, but when you go deeper, okay, what exactly it means in this context and so forth.
If we have an answers, I don't know if you can see my presentation.
Yes,
I hope that's okay.
Yes, the presentation is working, but I would like to just trigger this, like welcome students, like just be brave. Yes. I know sometimes that this is kind of a moment, okay, who will speak first? I just spoke first. So students, now you're welcome to express what would be the definition of health for you.
I would say for me, it's not being unhealthy, not having something hurt or something that bothers me too much. But that would be for me.
Okay, no, it's a good definition. Perhaps yes, is the absence of disease, is a state of well-being, is not to be sick. Okay, is all this kind of definition is the definition that we use in our regular life, in our daily life. Okay, I think that with this definition we can advance a little bit more. Tell me, share with you this definition. Like a psychologist, this definition for me is very hard. Why? Because it's the very old definition after the second World War, and if from 1948, the definition of WHO. Health is, like you say, a state of complete physical, mental, and social well-being, and not merely the absence of disease or problem of infirmity. Okay, this is we say that it's a very hard definition of health because they don't give us agency, the opportunity to change the things, because it's like you are a healthy people or you are a sick person with a disease, with an impairment, with a for example, if you are carrying glasses, it's impossible to be a healthy person. If you have a problem with your teeth, it's impossible to be a healthy person. If you have a disability, it's impossible to be healthy. Why? The people with disability, and they are not a sick person, they don't have a disease, they have a vital, is a situation in their life, a condition. We say, okay, the evolution of this term is that at this moment, we prefer this kind of definitions, and okay, I will speak a little bit more about behavior design, but we need to put in our minds this kind of definition. Health as the ability to adapt and to self-manage in the face of social, physical, and emotional challenge that we find in our life. Is the ability to adapt and self-manage our situation, our life situation. And that is very important, because this definition from one of my mentors in Toronto University, Alejandro Haddad, is very useful, because this definition gives us more agency, more capability to do things, to be healthy. It's not a passive situation, like in the definition, the official, the regular definition of the WHO. This offers us the possibility to do something, to face, to change, to do things, behavior, like you say. Okay, after this definition in 2016, in the meeting of the Global Conference of the Health Promotions, the most reputed specialists around the globe, around the world, established that if you want that a population become a healthy population, a healthy society, you need to work in 3 different axes. The first is a good governance of the health system. The second is the healthy cities. The city must allow you to make exercise, to walk, to eat very healthy foods. And the third is the health literacy. We need that the people knows in which way they can manage their own health. This is very important. It's very important, this point. We are not talking about create more hospitals and to make more doctors and nurses and psychologists. I am psychologist. We are talking about another approach to the global health. Now we use the term planetary health, no, the planet, no, planetary health, like a very universal health. If you want that one population be healthy, it's not necessary to create more or to reinforce the health system. That is the 3 pillars of the health promotion. And when we go beyond that, and we try to concrete what kind of things the people we can do, like citizens, to be healthy citizens, you have eat a healthy diet, to be physically active, practice good hygiene, don't speed or drink and drive, practice safe sex, etc., etc., etc. Second question: what do you think that these tips has in common? What is the common characteristic of these 12 tips to be healthy? Some answers? It's very easy. Eh?
Avoiding risk.
Avoiding risk is one of them, of course. More opinions about what do you think that they have in common?
It's individual behavior.
Okay, it's behavior. All of this is behavior. All of these tips are related to something that the people can do, should do if they want to be healthy. And we need to, like a public health specialist, we need that they do. But we have this situation. It's very difficult to change the lifestyle of the people. It's easier for us to go to the doctor and ask for a drug, or for example, for a pill when we feel very stressed. we feel some anxiety, we feel depressed, we go to the doctor if we need to lose weight, sometimes we need to surgery, these kind of things. But change lifestyle is very hard to do. And there are a gap between the intentions. For example, all of us, we have a good attitude and intentions to be healthy people, to change our lifestyles. Sometimes when we say, we tell to ourselves, I need to do a little bit more exercise, I need to a little less chocolate, etc. I don't know, because it's going fast, too fast. Okay. And now we are working in this field, trying to help the people to change their lifestyle, but not only that. We are working in the eHealth Center in the Open University here in Barcelona, and the definition of eHealth is very, very difficult to some people to understand, but we are here in a very smart group, and we will see that it's very easy to understand, because eHealth, in some sense, is the same that health in this slide. Is the ability to adapt and to self-manage in the face of social, physical, and emotional challenge that we face in our life. But eHealth is do the same, but with technology. The group of show in Australia, they make one study, very in-depth study, analyzing with a very large number of experts in eHealth what is eHealth, and they say they arrive to this definition, no definition, these areas of eHealth: the use of digital technology to monitor, track, and info about yourselves. You can use your mobile application to assess the steps that you perform on the different day. The use of digital technology to facilitate communicative encounters between health stakeholders, for example, patients community, doctors talking to doctors about the different cases, or in the last part of this analysis of the areas of eHealth is the use of data science, artificial intelligence, to improve the health monitoring of all the world population. No? But what are these things in common? All of them are behaviors. When you use your personal health record to ask your doctor to get vaccinated, to track your physical activity, all of these are behavior. When you collect your data, you decide to put your data, to share your data with the doctors in the mobile application, in a research project, all of these are behaviors. And we need to do something that is very hard. We need to influence, we need to help the people to achieve their objective, the health objectives that they want to achieve. This is very important. We need to persuade people, not to manipulate people. Always we are working with the ethical, with an ethical perspective. That is very important. We want to help the people to change the behavior when they feel that they can do they can do their ourselves. Okay, but what is behavior? What is behavior? I will not ask to the group, because sometimes this kind of definition of behavior between psychologists, sometimes we are very debates about that. This man who is marking is BJ Fogg. I was with them and with other colleagues, you can see, in California in the Behavior Design Bootcamp. And he's working with industry. He's working part-time in industry, part-time like a Stanford professor. He's a professor of psychology in Stanford University. And he teaches us when very easy definition of behavior, very practical, that you can use in your projects and you can put in your mind when you are working in different projects in which they are involved the behavior of the users or clients or citizens or patients, whatever you want. The definition is very, very, very simple, but it's not simplistic, it's simple. He says, B.J. Fogg says, a behavior is a person doing something, an action, in a specific context. Easy, very, very easy. You change the person, Manuel, trying to explain what is behavior to a group of very smart students in Riga Business School. If we change Manuel and you put Agnis, is another situation, is another behavior. Doing something, now I am speaking about behavior. If we speak about poetry, it will be different situation, different behavior. In this context, online, perhaps in going to Riga, why not, one day, going to Riga, it will be different. It's very simple, one person doing something, one action in a specific context. For us, it's a wonderful definition because we try to influence in the person, in the action, and in the context. It's impossible to explain all the methodologies that B.J. Fogg used in a few minutes, but of course, I will send you this presentation. If Professor Agnis Stibe want to share with you, you can find the behavior model which you will find more information about that. And what is behavior design? Behavior design is not more and not less than a set of theoretical models. We need to work with theory, with evidence, with theoretical models and techniques, both from behavioral science and design, that can use to influence human behavior. We work together, behavioral scientists, with people specialists in design, campaigns, and communication. And that is for me, is a very successful triangle, because the psychologists, we don't know too much about how make specific campaigns to influence the people. We can think the idea that in which way we can try to influence, but we don't have the knowledge to design the specific campaigns. Okay, this is the persuasive technology. This is a book. I recommend this book from 2003. It's a book of B.J. Fogg. Look, you can read the title, Persuasive Technology Using Computers to Change What We Think and Do. This is a very interesting book, and he says the same. This persuasive technology is a mixed science between behavioral science, UX experience, communication, and technology. Sometimes we say, but that is UX, user experience. We say, okay, the user experience is mandatory. We need that the experience of the user will be very pleasant, if you want to say that, but it's not enough to provoke the change of their behavior. Perhaps it's a wonderful mobile application, it's very useful, I like the colors, the combination, but I don't make the shift to do the behavior that I want that the people do. For example, when they receive a signal, go to street to walk for 3 minutes. When they receive a prompt, I will explain in a few minutes what is a prompt. The people goes to introduce their data, their weight data, for example, these kind of things. If the people don't do that, the intervention will be unsuccessful, and we don't do that. Okay, very, very fast. We have wonderful examples of people around the world that are working in the persuasive and behavior design programs. In Australia, it exists the Center for Persuasive Technology and Society. In the MIT, and the Professor Agnis Stibe is one of the researchers, the project of persuasive cities, very interesting, how to change the context. Did you remember the context to make more easy to the people to do specific things? in the UCL, it sits the Center for Behavioral Change. There are a lot of people working very hard with a lot of papers, with a lot of science. For me, it's one of the most important. The professor Susan Mickey is one of the most important researchers around the world too. The Stanford Persuasive Tech Lab, when work in this lab, was Professor Vijay Fogg. You have in Cambridge, you have in Harvard, and you can see that the behavioral science, the behavioral design is very useful, not only for the academic world, but too for the companies in which you are working. After I will show you something that I have prepared for you. But now in the public health area, in the public administration, we have now, right now, Competence Center of Behavioral Insight in the European Commission, in the WHO, in the United Nations, and in the different universities. And United Nations, the General Secretary, sorry, Antonio Guterres wrote, no, perhaps no wrote directly Antonio Guterres, but the team, his team wrote this general guidance of behavioral science, and some of the things that they explain is that we need not only maintain a business as usual approach if we want to achieve the sustainable development goals, because we don't need only to change attitude or intentions. We need that the people taking medicine, allowing a child to attend school, halting violence, reducing stigma, reaching agreements, or saving money, all of these kind of things. We need that the people do specific behaviors. Someone doing something in a specific context, someone taking medicine, or someone get vaccinated. We have a lot of examples, the people that don't want to get vaccinated. Okay, we need to help them to make the right decision, or at least the decision that is supported by the evidence, the scientific evidence. Is a person, someone that is doing something, get vaccinated in a specific context, in his country, in a specific situation. Okay, we need to take in mind the behavioral, the definition of behavior. Okay, we are working in different projects with the hospitals. We are analyzing the reluctance, the problems that the chronic patient has. We are working with 20 universities, with trying to analyze what are the problems that the chronic patient has when they must use the mobile application, sometimes because they are old people, or sometimes they don't understand, or sometimes they don't want, they prefer to have a appointment with the doctor, and this is not possible because you know that the people are getting older day by day, and sometimes it's not possible to offer this personal attention, and they must to use mobile application or different. And sometimes we face with the patients barriers, and we need to design specific solutions to the problems that they show. And for do that, we have a very research toolbox, like we say. This is for us is one. I don't know if Agnis is agreed with, but all of different theories that we are working on are very based in this behavior fog model. He says in 2 minutes. A definition of what is behavior, what is when the behavior happens. And he says the behavior happens when at the same times we have in the vertical axis enough level, a sufficient level of motivation, we have a sufficient level of capability to do something, And in one specific moment, it appears a prompt, a signal, a trigger, and now he says a prompt that nudge us to do the behavior. And he says in this graphic, we can see the action line. The action line is very interesting because below this action line, the combination between motivation and ability, if the prompts appears, the behavior don't happen. File here, because perhaps the combination between motivation and ability is not enough to facilitate the behavior, that the behaviors occurs. Okay, I have an example here. For example, I have a low, a middle motivation, but some specific behavior is very hard to do for me. The behavior, the prompts appears. For example, if I receive a SMS or a WhatsApp and tell me, Manuel, you must to give us, I am one NGO and we need your help. Please donate €1 or 20 euros. Perhaps I have a motivation that is not enough, a middle motivation is very hard to do because 20 euros is too much for me. But in one moment, if I see, I watch television, I see that this NGO is working very hard in La India, in Africa, in doing a wonderful work helping people. Perhaps my motivation boost, my motivation increase, and when the prompts appear, the WhatsApp appears, I donate this 20, or perhaps this 20 euros, or perhaps this is a good way. If you want to design some specific campaign, marketing design, explain one product to one client, please make it easier. For example, in this case, I receive a prompt, I receive a WhatsApp that tell me, Manuel, if you can donate 20 euros, don't worry, with €1 can be enough for us. And I say, okay, €1, okay. My motivation is the same than before, but it's easier for me to give only €1 by using one very fast transference with the bank. In 1 minute, bam, I send you €1. And when I receive the prompt, the success, the behavior and the behaviors occurs. Okay, let's go. Some people say, okay, but we do a lot of things based on our habits. What is a habit? Because BJ Fogg is a specialist too in habits, and very fast. A habit is a cue that that facilitate one routine. For example, a cue is the coffee time, the break time in the master degree. I go to no coffee shop here with my kitchen. I take a coffee, or I call a colleague, or for example, in the right side, I receive a message. I have the routine. For example, Agnes send me a mail. I receive the mail, is the prompt. I receive a signal that asks me to go to my phone. You know that it's very difficult not to watch your iPhone when you receive one signal, spam, WhatsApp, Twitter, whatever you want. The routine is to see what he wants, no? And the reward is I feel very well because I know that Agnes want to send me a picture or a book or a paper or his last paper, for example, no? Because I feel very well. Cue, routine, and reward. BJ Fogg used this idea of habit here. You can see in the right side, if I want that the people, that the clients do something, I need to create habits. And in which way can we create habits? Doing the things for the people, this is not important. Very fast, very easy to do for them. When if it's enough easy to do for the people, the motivation don't matter. Really don't matter. If something is very easy to the people to do, the motivation, sometimes you don't have too much, you don't need much motivation to see your mobile phone. Why? Because sometimes you go to the boss, and when you put, sorry for the expression, when you put your ass in the sea, automatic is the prompt to watch your mobile phone. You understand? And this is very important in industry, because you are people that are working in business and industry. They do this perfectly, because this is the secret of this kind of the platforms that change our behavior all the time, and sometimes more than 115 of times we see or different social networks. It was hard to do, to watch to consult, to see my WhatsApp, for example. If they ask me about my password, or if I send a message, a WhatsApp, and if there are a lack, a retard of 5 minutes from the moment that I send you to the moment that you can see my mail, perhaps WhatsApp in this moment it will not be the company that right now is WhatsApp or Netflix or Telegram or whatever you want to put here. That is the very important thing. You want to design, make the things easy to the client, to the patient. More questions. We try to do the same with exercise. Why not to help people to create the habits that they want to create? Some people say, okay, I want, but I don't know in which way we can do that. And we try to make it easier to increase their motivation when it is possible, but if it's not possible, we use this try this kind of tricks. For example, say someone, okay, don't worry, if you can walk for 30 minutes, okay, with 5 minutes is enough for us. Okay, 5 minutes, it's too hard for me to walk 30 minutes, but 5 minutes, why not? One can I try? And the people do that. When the people feels that they can walk 5 minutes, they feel, okay, 5 minutes is not enough. Perhaps tomorrow 10 minutes. Okay.
Manuel?
Okay.
Exactly 5 minutes. Yeah.
Okay.
So we already have the next guest speaker, and I would just say that guest speaker is welcome to listen and join in, and then we will wrap up with you, Manuel, in about 5 minutes with the questions, and then we will switch over
5
to
minutes.
the next.
Okay, I have here my prompt. I have here my mobile phone with the hour. Another model, very fast. The COM model. The COM model is very close to the behavioral fog model. Is from the University College of London. They say if you want that something happens, you must take in account the capability, motivation, and the opportunity in which the behavior can appear. Psychological or physical ability, reflective and automatic mechanism. I don't want to explain too much. If you are interested, the behavioral change wheel, for me right now, is one of the most powerful tools to think and to design behavioral change intervention. There are a lot of papers because they use in the public health campaigns, they use in the individual or groups intervention, and you can see in the middle is a tool that can be very useful to make a diagnostic. And after, when you have a diagnostic, it exists different guides that helps you to follow the different steps. You can use different functions, interventions, education, persuasion, incentivation, coercion. I don't want to read because you will have the presentation. This is the idea. How it works? Very easy. If you want to design, first of all, you must define the problem in behavioral terms. It's very important. What do you want that the people do? When, in which way, and for this reason, you can I recommend to read the book of Behavioral Change Wheel, A Guide to Designing Intervention, because it's very, very easy to understand for all the people. You must to select the target behavior, specific detergent. I want that the people and that the clients reserve in my make this click in this specific button, in this specific link. Stage 2, identify functions intervention, how we can do that. Perhaps if I have a diagnostic and I see that the people don't have enough education to do that, they don't have enough skills, we can use these different programs of the coercion or education or training them. For example, in vaccines, they are using the coercion. If you are not vaccinated, you can go to the bar in Spain. This is a drama, this, you know, because we like a lot the bars and restaurants. And if you don't show that you are vaccinated, you can go entry. This is a restriction, but it's an incentivation because the people say, okay, I am anti-vaccines, but I want to go to the restaurant. I get vaccinated. Okay, I lose, you know. And I don't want to explain to the different stages, but please, if some of you are interested, go to read this paper because it's wonderful. This is not necessary. But okay, I want to explain only that, like a psychologist, we know that it exists 93 behavioral change techniques, 93 things that we can do to change the behavior of one person. It's a very impressive work, systematic work from the different university led by Susan Mickey of the University College of London. It's a nice way to understand. And for example, in one specific mobile application, we have different strategies. Some of them provide feedback on performance, prompt self-monitoring on behavior in different analysis of the different mobile applications that are successful to change the behavior of the people, getting them that they do more exercise. This is the behavioral change technique that we need to include in the mobile application if we want that the likelihood of the success happens. Only finishing, if you want, you can read specific guides for public health, but that can be very useful for the business too. Guide for local governments, a guide for national government publishes in the Public Health England. We have different another models like Harry Oina. I recommend you this model if you are working strictly with a mobile application. We have the different strategies or tools that we can use, including in the mobile application. For example, if it's a health mobile application, a doctor explaining, then working with his expertise or facilitating cooperation between patients, or facilitating, if it's necessary, social cooperation. All the people with your same condition are doing that. It is a very nice, it's a very nice tool. And of course, we have this wonderful hyper performance Stibe method that is I can explain because I am shy, because the master is here explaining to you in other session.
We are working on that.
Okay, I know. And we are finishing. That is our idea. We are working in trying to help people to change his behavior and help them in the projects in the hospital and different projects, analyzing and using different tools for different purposes. And don't forget that the chief behavioral officer will be a professional that must be in a lot of companies, because all of them want to change the behavior of the citizens. And here we have some books that I will send you to have more information about that. Thank you so much, and sorry for the delay.